The need for a more dedicated medical care for older citizens in Nigeria has been emphasized. A team from a non-governmental organization, Marro Healthcare Initiative, while on a free outreach for older adults in Kabusa community of the Federal Capital Territory, said older citizens are any nation's historical heritage and should be adequately catered for. The founder, Marro Healthcare Initiative, Mrs. Sandra Okoli Kekakbo, specifically called on the Minister of the FCT, Barrister Nyesom Wike, to include welfare of the elderly in the nation's capital in his administrative policies. Here is a report. Head of the team and founder, Marro Healthcare Initiative, Mrs. Sandra Okoli Kekakbo, highlighted the importance of regular health check for the elderly. She referenced how older people are managed outside Nigeria and said her organization is working towards replicating same across the 36 states of the Federation and the FCT. Mrs. Kekakbo called on the FCT Minister, Barrister Nyesom Wike, and others to invest in facilities and programs to aid the aging phase for the elderly.
There's going to be a home, like the chief has promised. He has said it, and I'm going to follow in bumper to bumper to see how there's going to be a very big home. Healthcare for the older people, especially for the older people. There is a way I have my dream, and it's going to come to pass. We want to get started in FCT, and I believe strongly that the minister, by the special grace of God, Nyesom Wike, is going to come in.
Secretary of the organization, Dr. Patrick Daka, while also speaking, described the elderly as custodians of wisdom and the country's cultural heritage who should be taken care of. He is of the opinion time for creation of home for the elderly in Nigeria is right.
Some of these elderly, one, they are relegated, two, they are stigmatized, three, they lack care. Now the need for older adults home is bringing them together, forming a platform that they interact, forming a platform that medical teams like this will have access to them from time to time. Now exercises will be conducted, spiritual exercises will be conducted, and before you know it, they are what? Physically, mentally sound.
One of the older citizens, Mrs. Lara Balana, spoke in Gbagi language on behalf of the others, full of appreciation.
Mama said he dey happy as he see people and the help that he want. As if he will come today and to give them some yes, he is happy and he wish that people every time.
Chief of Kabusa, Samuel A. Bo, commended the team, expressing the hope that every older person in the community would be reached at the end. Chief Samuel disclosed that only one primary healthcare exists in Kabusa to attend to all the people, including the older adults. This, he added, is inadequate and called on the FCTA to take action.
How I wish a hospital should be built in this Kabusa community that can accommodate much more health issues that may arise around and within Kabusa community. And in relation to this, what had happened, how I wish the government of today should see it and then quickly respond to the fact that we are in need of such things in Kabusa community.
Parts of activities making the outreach was health talks simplified in Gbagi language on healthy aging habits, as well as distribution of palliatives to participants. Marro Healthcare Initiative is a non-governmental organization dedicated to providing healthcare services to older adults in Nigeria. Rosemary Kokotega, ASO Television News.